Good afternoon, everyone. And climate change, as you know very well, is probably the biggest global health threat of the century. And the evidence is the weather you can see. It's changing day by day, and in a given day also very fast. And all these extreme weather changes, whether this melting of glaciers, rising sea levels, they are just the tip of the icebergs. There are many catastrophes that are expected in coming near future, and we have very little time to act, especially if we keep on polluting the world with the current pace. So what climate change is all about? The infrared rays that come to the Earth atmosphere get trapped, and they remain trapped in the Earth atmosphere for a prolonged period of time by the fossil fuel emissions and many other chemicals emitted by human activity, and also the inhalational anesthetic agents that we anesthesiologists are using in our day-to-day practice. And you will be surprised to know that various articles quote that we anesthesiologists are responsible for up to 0.1 to 3% of the entire global greenhouse effect. So our contribution can be a very significant contribution in controlling the greenhouse effect in near future. And there are many inhalationals like isoflurane, halothane, even nitrous oxide that has been implicated in destroying the ozone layer, which prevents the ultraviolet radiation from reaching the Earth. Although it was known since early 80s that these inhalational agents does cause greenhouse effect and causes ozone layer depletion, but these were prevented from being phased out with other chlorofluorocarbons because they were considered essential for human existence. As per the Intergovernmental Panel on Climate Change, which has warned that if the Earth's average global temperatures rises to 1.5 degrees centigrade more than that of pre-industrial era, that would lead to many catastrophes on the Earth, which will include submerging of many of the coastal cities in the world, as well as extinction of many animal and plant species from the Earth. And as per the climate clock, which is installed in many of the countries nowadays, we will be having less than 6 years time on 22nd of July this year for achieving this 1.5 degree centigrade endpoint if we continue with the current pace. And if we exceed the current pace, probably we'll achieve this point within less than 6 years also. There is another important myth that needs to be busted from the minds of we anesthetists, that once we use the anesthetic agents, they are vented out through the scavenging system, go outside and gets destroyed in the atmosphere. Walmer et al. Studied the commonly used 4 inhalational anesthetic agents, their concentrations at 4 different sites around the world, and you will be surprised 2 of these sites were far away, about many 100 kilometers far away from any nearby operating facility. And what they found out was rising concentrations of isoflurane, desflurane, and sevoflurane, although halothane concentrations were steadily seen decreasing, but their presence in the year 2014 signify that still it is used in many parts of the world, because the atmospheric life of halothane is just about 1 year. Then coming to individual inhalational agents, there was a study by Alexander et al. In which they demonstrated that by switching from desflurane to sevoflurane over a 5-year span of over a 5-year span period in hospitals of British Columbia University, they were able to reduce the carbon emissions by as much as 70%. Then, to increase the public awareness, there was a study by Ryan et al. In which they compared the carbon emissions that were produced by using inhalational anesthetic agents and compared to that produced by motor driving for an equal amount of time. So what they found out was that if we use 2% of sevoflurane for at a fresh gas flow of 2 liters per minute, it is like driving of a motor car for about 8 miles per hour. And similarly, for the same flow rates, with 1.2 percentage of dial settings, isoflurane causes around 18 miles per hour. Whereas if you look at desflurane, it is very high, about 200 to 400 miles per hour. And the reason is because the atmospheric lifetime of desflurane is quite high as compared to the sevoflurane or isoflurane. And similarly, nitrous oxide, which has got a very high atmospheric life, causes very high carbon emissions, but during a prolonged period of time. Now, another important study by Sherman et al., in which they studied the carbon emissions at every phase of a drug, that is from procurement of raw materials, manufacturing of the drug, transport of the drug to the hospital, the administration of the drug, like in TIVA, we use a syringe pump of maybe of any kind, the electricity consumed, the plastic waste generated, and that drug which goes to atmosphere and causes pollution. And they studied it for 3 of the inhalational agents, and 1 was propofol. And they found out that propofol use causes less than about 10,000 times less of carbon emissions as compared to desflurane or nitrous oxide. That is very much significant. Now, but is propofol 100% safe? It is something that doesn't evaporate, so it won't cause any air pollution. But a report by AstraZeneca clearly mentions that it is known to cause growth inhibition and death of certain algae when it goes to the water draining the hospital, and acute toxicity in small crustaceans and freshwater fish. So whatever propofol is left out, it should be discarded and should go to incinerator for destruction and should not go to the drains. And one should minimize propofol wastage. Now, there was another important study by Kostrubiak et al., in which they studied the amount of propofol used in the hospital, and based upon that, they estimated that the amount of propofol that is excreted by those patients who were administered this propofol should be 1%, as 1% propofol is usually excreted unchanged in the urine of the patients. But the propofol concentrations were found to be very high as compared to that 1%. And the reason they could guess was that reversal of glucuronidation that was taking place in the human body was getting reversed due to some reason in the wastewaters. So our body was actually metabolizing propofol, and it is going in the wastewaters and getting regenerated due to some reason. Another important study by Parvatkar et al., in which they again studied cradle to gate carbon emissions of 20 most commonly used TIVA drugs for production of 1 kilogram of drug used. And they found out succinylcholine was the least carbon emitting with around 28 kilogram CO2 equivalents, and in comparison to that, dexmedetomidine was the highest with 3,000 kilogram carbon dioxide equivalents. But it should be noted that these are for 1 kilogram of drug production. So even a small induction dose of propofol, that is around 100 milligram, far exceeds the dexmedetomidine, which is used in the entire operating period of about 2-3 hours. 100 microgram, it exceeds that by a single shot. So here we come to a situation where on one hand we have inhalationals who produce a large amount of air pollution, and on other hand we have intravenous anesthetic agents which are having potential to cause water pollution. But given the situation at present, since our main aim is to reduce the carbon emissions as quickly as possible, the situation is more in favor of use of TIVA. So I would like to request all of you to start using TIVA if you are not using up till now, and because ideas without action aren't ideas, they are regrets in your future. Thank you all.